At the World Muscle Society meeting, there was new information provided on risdiplam, which is an oral splicing modifier that also increases the production of SMN protein. What's different from nusinersen, which is delivered intrathecally, and even from the Avexis 101 gene therapy, which is delivered either intravenously or intrathecally, but targeted more to motor neurons, is that this risdiplam, because it's oral, it gets systemic exposure. It should go into muscle. It should go into other tissues besides neuronal cells. So it may be that we'll see a different type of response to risdiplam than we do to the other two types of treatment. Now, there are several different studies going on, all called the FISH studies. And there's a sunfish study in the type 1 babies, or firefish rather, in the babies, and a sunfish study in the older type 2. And we got some updates on these studies at the meeting today. But there are two other studies that are of particular interest. There's the rainbow fish study, which is for the pre-symptomatic babies treated in the first few weeks of life. But I want to talk about the JEWELFISH study. JEWELFISH has been around for a few years now, and it was for patients originally who had received a different treatment and for one reason or another stopped that treatment for SMA. For example, they may have had nusinersen, or they might have been on a drug called alesoxime, came off of it, and Roche was good enough to say, well, we want to try to provide something for these patients, so they developed this open label study, no placebo control, and these patients can come in and get the risdiplam, and it's a safety study, but it also allows us to explore how they're doing, how do they respond, is there any efficacy? Now, recently, they expanded the protocol, and I'm delighted with this because this new change to the protocol allows us to bring in patients who've completed the gene therapy at least 12 months ago. So they've completed that study. Okay, it's done. And it gives them an option to come into the JEWELFISH and look at a combinatorial treatment to say, okay, we've been treated with the gene therapy, we're doing well, we may want to just do nothing more, we're very happy with that, or it gives the parents and the investigator the chance to say, well, let's see how they do if we add on risdiplam. Is the combination actually going to be beneficial, more so than the risdiplam alone? It'll allow us to look at this combinatorial treatment in a very careful way, looking at safety and also trying to capture, is there any added efficacy? So I'm quite eager to see how this will evolve, and perhaps next year we'll have some data on this to report.
I have been offering to my patients the participation of this trial because of the easiness of giving the medication instead of lumbar punctures as an oral medication. And I've been discussing the potential, what if this medication is not as powerful as the other medications? I think the major worry is if the patients want to go back to their old treatment, whether we could get the insurance company reapprove the medication after participating in these new clinical trials. So I think it requires a convincing result before I can recommend to enter to this clinical trial with good heart, good faith that this will be the solution for that patient. So I am a little bit cautious yet, but I've been discussing with my patients the participation in this study if they feel that the current treatment is too cumbersome or causes too much pain and side effects.